Understanding the distinction between bipolar I disorder and major depressive disorder is crucial for anyone preparing for a licensing exam in mental health. While these conditions may appear similar initially, they have fundamentally different features that affect both diagnosis and treatment. Accurately identifying which disorder a client is experiencing ensures that you can provide the most effective support and intervention. Misdiagnosis can lead to inappropriate treatment plans, potentially impacting a client's progress and well-being. That's why mastering these differences is not just a test requirement, but a vital skill for your future practice. Now, let's examine the DSM-E criteria for bipolar I disorder. The hallmark feature is the presence of a manic episode, which must last at least 1 week unless hospitalization is necessary. During a manic episode, individuals may display symptoms such as inflated self-esteem, decreased need for sleep, and engaging in risky activities. It's important to note that if someone requires hospitalization due to the severity of their symptoms, the episode qualifies as manic regardless of its duration. While depressive episodes often occur in bipolar I disorder, they are not necessary for the diagnosis. The focus remains on identifying at least one clear manic episode. Major depressive disorder, often called MDD, is diagnosed when a person experiences at least 5 specific symptoms over a 2-week period. These symptoms can include persistent sadness, a loss of interest in activities, noticeable changes in sleep patterns, and recurrent thoughts of death. It's important to note that these symptoms must represent a change from previous functioning. Additionally, for a diagnosis of MDD, there should be no history of manic or hypomanic episodes. If such episodes are present, a different mood disorder may be considered instead. This distinction helps clinicians ensure an accurate diagnosis and appropriate treatment plan. Both disorders share several overlapping symptoms, making it challenging to distinguish between them. Clients may experience significant changes in mood, disrupted sleep patterns, and fluctuations in energy levels. Difficulty concentrating is common, as is a tendency to withdraw from social interactions. Problems at work or school can arise, and in some cases, individuals may struggle with thoughts of suicide. These similarities are especially pronounced during depressive episodes, which can make accurate diagnosis more complex. Recognizing these shared features is essential for understanding why careful assessment is needed. At this stage, the differences between bipolar I disorder and major depressive disorder become especially clear. Bipolar I is defined by the presence of at least one manic episode, which often involves dramatic mood shifts, impulsive decisions, and heightened energy levels. In contrast, major depressive disorder is characterized solely by periods of low mood, without any manic phases. Factors such as the typical age when symptoms first appear, patterns in family history, and the nature of any psychotic symptoms can provide important clues for distinguishing between these two conditions. Let's pause for a moment to consider a real-world example. Sarah is a 28-year-old graphic designer who exhibits classic symptoms of bipolar I disorder. She experiences periods of very little sleep, has grand and ambitious ideas, and engages in risky spending behaviors. These episodes alternate with phases of deep depression, highlighting the cycling nature of the disorder. Additionally, Sarah's family history supports the diagnosis, as similar patterns have been observed among her relatives. Recognizing these patterns is crucial, especially if you're preparing for an exam on mental health conditions. Sarah's diagnosis aligns with bipolar I rather than major depressive disorder because she has experienced a full manic episode. Symptoms such as racing thoughts, engaging in risky behaviors, and significant disruption to her daily life are characteristic of mania. According to diagnostic criteria, the presence of even a single manic episode is enough to rule out major depressive disorder. This distinction is important, as major depressive disorder does not include manic episodes. For test purposes, remember that mania is the key feature separating bipolar I from MDD. Mark is a 42-year-old accountant who has been experiencing persistent sadness, a loss of interest in activities he once enjoyed, and noticeable changes in both his sleep and appetite. He often feels worthless and struggles to find motivation in his daily life. Importantly, Mark has never experienced episodes of mania or hypomania. His symptoms are limited to these prolonged periods of low mood and energy. These characteristics align closely with the diagnostic criteria for major depressive disorder. The absence of manic or hypomanic episodes helps distinguish his condition from other mood disorders, confirming a classic presentation of depression. Mark's case aligns with major depressive disorder because he exhibits the required number of depressive symptoms over the necessary duration without any evidence of manic episodes. In contrast, a diagnosis of bipolar I disorder requires at least one manic episode, which is entirely absent in Mark's history. This distinction is crucial when evaluating mood disorders, especially in exam settings. Always look for clear signs of mania or hypomania before considering a bipolar diagnosis. Without these, even if all other depressive criteria are met, the diagnosis remains major depressive disorder.